What are the top things that affect children? Sexual abuse is something that hugely impacts mental and physical health and longevity. My name's Marie Seiler. I'm a pediatrician with 35 years of experience. I shared about the Mama Bear Effect, 5 body safety rules. One mom in particular came to me. She said, I knew the 5 body safety rules. I knew how to rock the talk. I had said something to my daughter, reiterating the 5 body safety rules, 12 years old, and she looked at me funny. She said, I have to talk to you. She had been sexually abused for 4 years, from age 8 to age 12, by her stepfather. And she said, had I not had that information, I wouldn't have reacted as confidently.
My name is Martin Finkel. I'm a pediatrician. I co-direct and co-found the CARES Institute. My particular area of interest and focus since the early 80s has been on sexual victimization of children. I can't imagine that there is a pediatrician or family doctor who is unaware of the pandemic of sexual victimization of children. I no longer ask kids whether they've been exposed to pornography. I ask them at what age did they first begin to look at it. An 8-year-old says 6. It's messaging that can be incorporated in routine anticipatory guidance at a minimum every annual examination. That should be a component of the anticipatory guidance that they provide. Sexual victimization of children, I think, is preventable. We have to sort of use a community approach. We all have a responsibility for children to develop in a healthy and nurturing environment. And so it's extraordinarily important that not only parents are at the table in terms of prevention, but so are religious organizations, schools, clubs, social media, all these things are partners in making sure that children have healthy growth and development. When we see parents who happen to be hypervigilant, we ask them, did you ever have something happen to you when you were a child? And they look at you like, how did you know? They're afraid or anxious to raise the issue. They don't want to imagine that they weren't able to protect their child. So there are lots of behaviors that if a parent is concerned about, they should ask the primary care doctor, and the primary care doctor will guide them, or in more complicated cases, may have a psychological evaluation of the child.
How many kids are being affected by child sexual abuse? Very, very rough. At the very least, it would be, say, 1 in 10. It's more. But say 1 in 10 kids. We can't ignore this. This is a huge part of prevention in pediatrics. Let's make it part of every pediatrician, nurse practitioner that deals with children on a daily basis.
We do know that kids who learn about sexual abuse or their right to personal space and privacy are likely to tell sooner than later. We need to double our efforts on primary prevention, and we need a community. The medical community is one that is trusted and is in position to do primary prevention.